Now I would like to explain about hernia. I think there are many people who are diagnosed with hernia at the hospital. So, what is it? I will explain that, but in fact, there are different types of hernias. Today I will explain about lower back, herniated disc in 4 parts. First, what is herniated disc? Second, about the symptoms of it. Third, prognosis if you have it. Fourth, about the surgery. This will explain what condition you will be in when surgery is necessary. So first part. What happens to your lumbar vertebrae when you have herniated disc? First, look at this diagram. The diagram is divided into upper and lower parts. And the upper diagram is a diagram of a normal lumbar vertebrae. And the lower diagram is a lumbar vertebrae with herniated disc. First, in the case of a normal lumbar vertebrae. By the way, this is a diagram of the lumbar vertebrae seen from the side. Here, there is the pelvic part, a bone called the sacrum, and above are lumbar vertebrae number 5, 4, 3, 2, and 1. And between number 4 and 5. This is made of cartilage called an intervertebral disc. There is cartilage between the bones. And behind it is a spinal bone called the vertebral arch. And the spinal nerves pass through this. This tube is also called the spinal canal. It has a structure like this. Now, let's look at a diagram of this cartilage part seen from directly above. This is the abdominal side, and this is the back side. This is the cartilage part. Inside the cartilage part, the intervertebral disc cartilage, there is a jelly-like thing called the nucleus pulposus, written in red. And behind that, inside the spinal canal, the spinal nerves pass. And then, from the side, a nerve root is formed, and the nerve branches out. And the nerves continue down to the legs. So what happens in people with herniated disc? The nucleus pulposus, a jelly-like part, is protruding out towards the back due to stress. And when it protrudes, it puts pressure on the nerve roots, where the nerve branches emerge. This causes symptoms. In the diagram seen from the front, the cartilage at vertebrae number 4 and 5 has protruded backwards, putting pressure on the nerves, which is what causes a herniation. Next, I will explain the symptoms of herniated disc. First, numbness and neuralgia will occur. These symptoms occur in the buttocks, front and back of the thighs, shins, and calves. It depends on which part of the nerve is compressed. But generally, if the herniation occurs in the upper lumbar vertebrae, symptoms will appear in the front of the thigh. If the herniation occurs lower down, symptoms will appear in the toes and calves. Walking problems may also occur. This is because the pain is so severe that you may walk with your body bent to the side. Or your ankles may not be able to lift due to muscle weakness, causing an odd gait. If you cannot lift your ankles, your muscle strength will decrease even further. Sensory disorders may also occur. For example, you may lose feeling below the knee. The worst case scenario is bladder rectum dysfunction. That's because the nerves run not only to the feet, but also to the internal organs. They run to the bladder and rectum. And if the nerves there are damaged, you will no longer be able to control your urine or feces at will. You may pass urine or feces on your own, and not even realize that you have passed them. And thirdly, about the prognosis. The period when you are in so much pain that you cannot move is called the intense inflammatory period. After this period, the period when you are able to move your body is called the inflammatory period, when you feel pain but can endure it. And the plateau transitional stage is when it hardens into cartilage. After that, over the course of years or decades, it progresses to a condition called spinal canal stenosis, which I'll explain in another video. Finally, about the surgery. First, there is the case of a double hernia. This is when there are 2 hernias. For example, if two hernias occur at the same time, the pain is unbearable, so I think surgery is the way to go. Next, when bladder-rectum dysfunction occurs, this should also be operated on. Finally, there are cases where there is severe muscle strength and sensory impairment. For example, if you have no feeling below the knees, and you can't move a single finger on your foot, in that case I would recommend surgery. This concludes my explanation of herniated disc. Thank you for watching.